Good afternoon, and welcome to the Live Healthy Miami Gardens Facebook Live weekly series. The Live Healthy Miami Gardens Facebook Live is a weekly health and wellness series brought to you by the City of Miami Gardens, Live Healthy Miami Gardens. And our goal is to bring our community information and resources to help them make the healthiest choice possible for themselves and their families. I am Dr. Sandra Williams, and today I will be your host. So, Live Healthy Miami Gardens was born from the realization that though health is largely influenced by individual choices, the conditions in the communities where we live, learn, work, and play are also major factors affecting people's ability to make healthy choices. Live Healthy Miami Gardens is a community initiative working to make the city of Miami Gardens a healthier place to live, work, and play. The initiative is part of the city's efforts to reduce poor health outcomes by engaging community residents to improve selected public health indicators. Live Healthy Miami Gardens is not just a city effort, but also a true community engagement initiative. And since 2014, the city has been working collectively with over 110 stakeholders and 66 organizations focused on 5 health areas, which include alcohol, tobacco, and other drugs, physical activity, healthy eating and nutrition, mental health, and primary health. And I would like to introduce our guests. We have Dr. Jodi Grace, and we also have Dr. Max Orozoli. Awesome. So happy to have you both here today to discuss this very, very important topic. And so we can start off by hearing just a little bit from Dr. Grace in terms of, and Dr. Orozeli, what is the Miami Gardens COVID-19 Community Needs Assessment?
So thank you for having us, Sandra. So yes, I'm an associate professor of psychology at St. Thomas University. And so I'm happy to be here on another version of Live Healthy Miami Gardens Facebook Live. So thank you so much. So what is this community needs assessment, this sort of fancy name that we're hearing? Basically, we want to learn from the Miami Gardens community what your concerns are, what your thoughts and feelings are, what your opinions are on COVID-19, on the flu, and on vaccines, like the COVID-19 vaccine and the flu shot. We want to learn more about what Miami Gardens is thinking about these things, maybe what's helping you, supporting you to get vaccinated, if that's your choice, or maybe what's making it difficult for you to do that, what's keeping you from doing that, or what are you concerned about regarding that. So really, we'll get into more specifics, but basically, we just want to hear from the community how they're feeling and thinking about, it's been a tough year, about these issues, COVID-19, the flu shot, and then the good news, the vaccines that we have. Max, would you like to add?
Yes, thank you again, Sandra. So, like Jodi was saying, it's about empowering the community. It's about listening to your voices. It's about taking information that you guys are going to give us. This needs assessment is really a collection of your thoughts. And once we collect your thoughts and your perceptions of things, we take that information and we analyze the data and we create a sense, I guess, a report showing recommendations on how to deal with the specific types of issues that we're addressing. In this case, would be COVID-19 and vaccination for both the flu and COVID-19. And we're looking to see how people feel about it. Are they happy that we have vaccines? Do they trust it? They don't trust it. If they don't, why? So we're doing both a quantitative and a qualitative, and we'll get more into detail. We're conducting focus groups, and we're also sending out surveys that are going to be done online to get your thoughts. So in a nutshell, that's the general side of it all, and we'll get more into specifics.
Thank you. Thank you for that. Now, I've heard just in the community, hearing folks' opinions and thoughts about the COVID vaccine. They're sharing, their concerns, their whether or not they've taken it. Now, why do you think the COVID-19 needs assessment in particular is the right starting point for this work?
I think that it's a great start, because if we want to encourage the community to get vaccinated, and we can talk about why it's so important for the community at large to get vaccinated. So if we want the community to do that, well, let's ask first, what are they thinking? What are some of their concerns, or what's making it difficult to make it happen? And then this is just the first step, because then what Live Healthy Miami Gardens wants to do is find out those concerns, and then design ways to help support the community in getting those vaccinations. Do you need better transportation options? What about time? Or can we answer some questions that you might have about trust, like Max mentioned, or concerns that you might have where you're not understanding exactly how the vaccine works, or the amount of time it took to develop the vaccine. Maybe people are wondering, is it safe? How effective is it? So we want to find out what the concerns are, so that then we can say, well, let's get those questions answered, tailor communications and outreach to the community so that we can encourage more people to get vaccinated. I'm sure Sandra will talk about it more, but of course we want to reach at least 70% of the country at large, of global communities. So not just Miami Gardens, but the country and globally, 70% to 85% of the population needs to be vaccinated for us to reach herd immunity. And herd immunity means that then COVID-19 is not being transmitted, right, as easily. In fact, we have sort of protection, so it's not getting transmitted. That's the way to really slow down and stop the spread of COVID-19. In Florida, I checked before I got on, and we know that in the United States, we're at about 29% to 30% fully vaccinated in the United States. And in Florida, I saw a couple of different numbers. We're hovering between 27% and 30% fully vaccinated. So we have a ways to go to get to 70%. We do see more people, they're in the process. We're at 42% have one dose if they're maybe doing Moderna or Pfizer. So we still have a ways to go. So this is going to help us learn that information about how can we get to that 70%. Because I said another day or a few days ago, I think Miami Gardens can be a leader on this. I think we can lead in South Florida and get to that 70%. That would be a really great thing to be able to say, we did it. We did our part in the state, and we did our part in the country.
Yeah. And to add to on Jodi's comments, by the way, I'm faculty member at Fordham University. My background is actually medical sociology, and I look at biostatistics. So one of the statistics that Jodi just gave is about the herd immunity. We need about 70 to 85%. What that means is that the population will be able to transition nicely. An important thing to kind of disclose is that if we don't get to that herd immunity, what happens is the virus keeps on spreading. And as the virus spreads from person to person, it increases the likelihood of more mutations, new strains. That's the way the virus operates. The more people that are infected, the greater statistically the chance of new strains being created, because they replicate in our bodies. So if we want that to come down, we need to increase vaccination. So part of this needs assessment is to find out, what are your fears? What are your concerns? How can we reach out to you? How can we make you feel better about vaccine or the vaccines that we have right now? And it's not just the COVID-19 vaccine, it's also the flu vaccine, which happens every year. I know that Jodi and myself, as we are conducting some of this research, we're hearing people say things like, hey, is it going to change my DNA? Am I going to be okay? These are good questions that we need to hear from the residents to find out what the concerns are. So as we develop this needs assessment, we can send it back to Live Healthy Miami Gardens. We can kind of say, these are the gaps, or these are the fears that we see in the community. So it's really important. It's really important, like Jodi was saying, for us to really, really do this research so we can move forward, we can get back to normal, which is not having to wear a mask and socially distance and put the mask on and off when you walk into rooms. So hopefully get back to some kind of normalcy.
Awesome. Thank you. Thank you both for that. So let's say I'm a listener today and I'm saying, you know what? Okay, I'd like to share my perspective. I want to participate. I want my voice to be heard. What more can you tell me about how I can get involved in this process? I know you guys mentioned quantitative and qualitative. Those are some big research terms, but what does it mean for someone in the community who really wants to get involved and let their voice be heard? How can they do that?
So I'm glad that you brought that up because we have an ask for the community. So there are two ways. So yes, quantitative, all that means as, you're attaching a number to things. So you're filling out an online survey. The online survey would take you about 20 minutes to do. So I'm just going to be completely honest here. You got about 20 minutes to complete it. Now, if you complete it all the way, we do give you a $5 Walmart gift card for your time. And that would be emailed to you within 3 business days. So it's a survey where you're just answering questions. You can do it on your phone. You can do it on your computer. You can do it on your iPad. And we can post the link to make sure that you have the link so that you can see it. We've sent that out through the Miami Gardens listserv, but even through today, we'll make sure that we have information posted here on the Live Healthy Miami Gardens Facebook so that you can get involved. So a couple of things. You would need to be a Miami Gardens resident, 18 years or older. Okay, but anyone who is a Miami Gardens resident who's over 18 and over can take this online survey. 20 minutes. It is completely anonymous. We understand that people might not want their name attached to it. There's no way to trace your responses back to you. At the very end of the survey, you would get to something called the gift card page. You want to make it to that page because that means you're going to get your gift card. You would enter your email, but it's a totally different system. So there's actually no way to trace back your email to what you just responded to. So you would enter your email and then you would get that gift card sent to you. So we want to encourage people to complete that. We're looking for at least 200 Miami Gardens residents to complete that. We would love to have more, but that's our minimum goal of 200 Miami Gardens residents. So we can really try to hear from different zip codes, different people from different walks of life, different age groups. We are both representing universities. Max and I both are the 2 Miami Gardens universities. And I think that's important because if you look at the vaccination rates right now, nationally, the 18 to 29-year-old age group have the lowest vaccination rates. Now, keep in mind, they were also the last to be eligible. So I don't want to be too hard here on the young adult crowd because they may just be catching up in eligibility. But I also want to give a shout out to my St. Thomas University senior students who are working on this project and trying to reach out to the community to gather that information. So I'm wondering if, Sandra, if we can put that link up and then people could see how they could get involved. But that's not the only way. So I'm going to let Max take over to talk about the focus groups, which are qualitative. Just means like one, you're filling out something and circling or clicking a number. That's quantitative. And qualitative is more just like I'm talking, like me now. So take it over, Max.
Okay, thank you, Jodi. So qualitative really means that we want to listen to your voices and we are going to take notes. Right now, we're looking for 3 focus groups to be done by the end of this week or early next week. The first focus group is going to be between the ages of 18 and 34. Believe it or not, that represents about 33% of the population in Miami Gardens. The second focus group is anyone who's 65 and over. So for the first focus group, you need to be a Miami Gardens resident and be between the ages of 18 and 34. The second focus group, you have to be a Miami Gardens resident and be over the age of 65. The third focus group, because we're trying to hit the areas that we see per the literature, some of the areas that we may see some concerns with vaccination hesitancy. The third focus group is actually anyone in the community who is an influential messenger. Who do people listen to? So people in the community who others look up to. If you think you're one one of those individuals, we could encourage you to join the focus group. The focus group will be done. That one will be done next Monday. The first focus group will be done on Friday, which is 18 to 34. The second focus group will be done next Wednesday, and this one, the community messengers, will be done on Monday, the 11th of May. So there is a $10 gift card that we're going to be given. By the way, this is all virtual. There's no physical attending any places. We're keeping it very separated because of COVID for obvious reasons. So you will be getting a link. You will join through Zoom, and I will be the facilitator, and we'll ask you some questions. I'll ask you some questions about how you feel in regards to COVID and COVID-19 vaccinations, and you'll let us know, hey, I agree with it, I don't agree with it, I think it's great, I think it sucks. We don't know what you're going to say. We're going to take that information in a qualitative manner and kind of create themes. So we encourage you guys to please consider doing the focus groups if you meet the criteria, and you will receive right soon as we're done with the focus group. The focus group will take about 45 minutes to complete. It's basically just listening to your voices, and you will get a $10 Walmart gift card as soon as we're done. So I believe the links are up on the page. So if you are a community influential messenger, click on number 3, focus group number 3. If you're between 18 and 34 years of age, Miami Gardens resident, you be focus group number 1. And if you are 65 and over and also a Miami Gardens resident, that would be focus group number 2. Okay? So thank you. Sandra?
So I can, from the comfort of my home, complete this survey and get a $5 gift card. I can participate in this focus group from the comfort of my home, have a discussion, and get a $10 gift card without having ever left home. That's pretty awesome.
Yes.
So
yes,
I have a question. Now, what if I am an individual who I've decided I am not taking this vaccine, I don't want to take it, and you probably don't want to hear from me? Or what about those folks who've made that decision? Do we still want to hear their voices in both of the methodologies you described here?
Absolutely.
Absolutely. Yeah, exactly. Because we really need to hear from everyone, right? We need to hear from everyone. So I would love to have a conversation with someone who doesn't want to, an open conversation, right? And remember, on the survey, it's completely anonymous. So maybe you're a little worried that what people might think or say. That's okay. No one's even going to know. But we would like to know, because we want to know what your concerns are. And I have said oftentimes that there's nothing wrong with having concerns. There's nothing wrong with having questions, figuring out what are the reliable sources of information that you can trust. There's nothing wrong with that. Live Healthy Miami Gardens wants to hear from you. We want to hear from you so that then we can help address those questions, address those concerns. You're probably not the only one with that thought or that concern. It's quite normal. So I see that there's a question, but I wanted to see first if Max wanted to add anything about wanting to hear from everyone.
Yes, I think it's great. We need to listen to your opinions. There's no right or wrong here. We're not here to convince anyone to take the vaccine. This is not our job. Our job is to just listen to your voices. We just want to hear your concerns. If you have any, maybe you don't have any, so we can address your needs how you want to be addressed. So again, we're not here, we're researchers from the universities. We're not here to convince anyone of anything. We're just here to collect the data and listen to your voices. You need to be heard. We need to listen to you so we can inform to the right policy that would reflect your needs. Go ahead, Jodi. I think that you have a question.
Yeah, Sandra, do you want me to take that question?
Yes, please do.
Okay, so it says on the radio show, I did a Miami Gardens radio show. We all did. It says you spoke about the Tuskegee syphilis study. How does that relate to vaccine hesitancy in the Miami Gardens area? Well, Miami Gardens is the largest municipality in the state of Florida with a majority Black or African-American population. And as we know, unfortunately, there was a vulnerable population in Tuskegee. These were Black and African-American men. who were poor and an underserved population. From 1932 to 1972, 40 years, these men were supposedly in a health study where they were following the course of the disease of syphilis and it's a bad disease long term, right? So they were following the progression of the disease. Throughout the course of that study, of course, penicillin and the cure for syphilis came about, and the men were never informed about that or given that cure, even though they were told they were getting special health treatment. They were never told or given that cure. There was no informed consent in that study. It ended in 1972. And the revelations, when it came out what had happened, and I have to say, it wasn't a scientist that broke the news. It was a young journalist. So science had not owned up to it for 40 years. When that journalist broke the news, well, science had to make some big changes. And so in 1972, they brought together a commission to create something called the Belmont Report, which really changed how we do research, whether it's biomedical research or psychological research, with a major focus now on something called justice, which is about equity, right? So treating people fairly and justly and making sure that the people who participate in research, who bear the burdens of research, also reap the benefits, because that had not been the case. That was one of the major ethics violations of the Tuskegee study. It's not just Tuskegee, it's Henrietta Lacks and the lack of informed consent for the use of her cells and her family cells. It's J. Marion Sims, who did not use anesthesia to learn about surgical procedures on enslaved African women. There's a really ugly history. So I believe as a scientist, it's on us to rebuild trust, to be transparent about the past, and to show, though, the changes that have been made since the 70s to try to, first of all, never let those things happen again, and to be transparent and just moving forward with equity. Do people still have questions? Justifiably, absolutely they do. And it makes sense that people would have concerns and maybe have some trust issues. So what we should do, I think, in Facebook Lives and Live Healthy as scientists is to continue to communicate, let people ask those questions, and say, how can I help answer your question to rebuild that trust?
Thank you for that, Jodi. Thank you. And as I was thinking about the survey going out, I thought to myself, what if there is a listener out there that might have a group of folks, either in their church or either with an organization that they're a part of, and they want to get that group connected to the survey? How do you think that should best be done if they want to help in the efforts to get voices out?
Email me. So my email is, my first name is Jodi, my last name is Grace, jgrace @stu.edu. If you have a faith group, any organization, and you would like to get together, you can also email Max for the focus groups. So, but what we could do is we could plan a Zoom session where we all hop on and you can go through the survey on your computer or your phone, and we can make sure that everybody's okay and they're understanding what they need to do to answer the questions. I mean, I think you can do it on your own, but we'd love to do it together. So we could do a Zoom session together. And my students created a really wonderful and educational piece where they kind of talk about some of the common concerns that people have about the COVID-19 vaccine and the flu shots. You'd also benefit by getting to hear some of that, those educational resources.
Yes. So you can reach Jodi at jgrace@stu.edu. You can reach me at Max.Orezzoli, OREZZOLI @FMUNIV.edu. We would love to hear from you guys. If, like Sandra was saying, if we have a group, it would be great. We want to hear your voices. We want to hear your concerns. This is not going away. COVID-19 has stopped the world. This is not by any means a small little, flu season. This has really stopped the world from moving forward. Now, one of the things that we have been discussing is this just doesn't impact just your lives. It impacts the economic sustainability of a community. It impacts people's freedoms to move around or to feel safe. So this is a very important topic that we're trying to really listen to you guys so we can really make an informed consent, inform you guys about the findings and how we can better the quality of life for residents in the city of Miami Gardens.
Awesome. So it sounds like we want to hear from you whether you plan to take the vaccine. What if you've taken the vaccine?
No problem. We want to hear from you too and about your experience.
Awesome.
Yes.
Awesome.
Yeah. One of the things that we're thinking about is people may not know that just because you take the vaccine, what happens down the road? Do you have to get a booster? Are there going to be more strains? Is this something ongoing? Nobody knows these answers. So again, we would love to hear from you because we want to collect all your thoughts and package them up nicely.
Awesome. Now, Jodi and Max, have you guys got vaccinated?
Yes, I'm 7 days out from my second Pfizer shot. I had it last Monday. Super excited. So next Monday, I should be 14 days past second shot, which would mean I'm fully vaccinated, right, at that point. So super excited. And my parents who live in Tennessee, and they're in their 70s, they got vaccinated about a month ago, 2 shots of Moderna. And they are planning to come see me. And it's been a while since they've been able to visit. So that's been something very exciting. So at the end of my finals and all of that, the final exams are giving, they're on their way and we'll actually be able to hang out together. And so we're really excited about that.
Yeah. And I'm scheduled. I'm sorry. I'm scheduled to be taking my vaccine. I'm sorry. I'm excited about the vaccine. So
you're getting ready to take yours.
Yeah. My son, who's 16, just took his second one. So we're kind of rotating people. Yeah, so we're kind of rotating the families. We're doing one at a time, so we're not all sick. Whatever happens, we want to be able to just do one at a time and make sure that we're getting vaccinated.
That's awesome. That's awesome. So we're going to be collecting all of this great data because folks are going to flood to the survey. You're going to be getting emails from everywhere about wanting to participate in the focus group. And some folks might wonder, how do I find out what the results are? I'm giving all this information and what are you going to do with it? And how do I know what you're doing with it? And can you share a little bit about what's going to happen once you guys collect all this data?
Yeah. So first of all, the first line of people who should be informed about what we find are the people who participated, right? That's part of the ethics of research, that those should be the very first people who find out. So I am happy to come back and do another Facebook Live and share this is what we found, right? And so first, our participants should hear from us. Then what we're going to do is we're going to take those concerns, right, and figure out ways to support people. Do people need better transportation, different hours? What do people need? And then we're going to also try to address those concerns. What questions do people have that maybe we could answer to make them feel more comfortable, build trust, right, around the things that we talked about. So there will be communication campaigns coming out in Miami Gardens. Our providers, our partner providers, the 2 federally qualified health centers in Miami Gardens, Jesse Trice and Center for Family and Child Enrichment, are going to be partnering with us to offer those COVID vaccines. So we're really going to be doing a year-long effort based on what we learned to promote this uptake of getting the COVID vaccine and the flu shot.
So awesome. So everyone will be able to hear the results, hear how we're using them. And they could possibly also provide some recommendations in terms of ways that they think that we could potentially reach the residents of Miami Gardens. How about with
Can I say one more thing? I'm sorry to interrupt you. Can I say one more thing? I just wanted to make it clear. Remember that it's anonymous. So when we share results, right? So I just wanted to make that clear. We call it aggregate data. It just means it's grouped together so that then there's no way that anyone would know it was your response. So when we share, it's all anonymous and we're talking about groups. What did we find overall? Just to make people feel more comfortable about what we would be sharing.
Right. And Sandra, quickly, just to add to your last point, in the focus groups, people will have the opportunity to actually give us recommendations on where and how. And so we're going to ask for this feedback from the participants to hear about where we need to go from here.
Oh, awesome, awesome. And thank you, Jodi, for letting folks know that, again, this is anonymous. So in the event that I'm a healthcare provider, I will get in trouble from my job for telling or saying in the survey that I'm not taking this vaccine, or I don't want to take it. So my identity will be completely safe and anonymous. So thank you for letting us know that. Okay, well,
Absolutely.
I wanted to hear just a little bit about, I guess, both of your decisions for deciding to move forward with taking the vaccine. I'm sure at the beginning, everyone had lots of questions. Are you taking it? Are you taking it? Have you taken it? But you both have decided to take it. And what are some reasons or thoughts that drove you to make that decision?
For me, I was very worried about my parents at first. So when the ages were rolling out and they were available to take it, I was communicating a lot with my parents about when have you signed up? Are you calling? And so I was communicating a lot with my older members of my family first because they were eligible. And I was ready for my turn, but I also wanted to make sure I waited my turn. So I was waiting for the age eligibility. So when that was available, I already had been thinking about it. I'll be honest with you. COVID scares me quite a bit. And seeing the death rates over the past year was everyone. I don't need to tell anyone this. It was very upsetting to watch those numbers increase. I have a family history of cardiovascular disease and stroke. And I know that there can be a lot of cardiovascular problems that result beyond the respiration problems that can result from COVID. So, for me, I really just wanted to have the opportunity to utilize the science. Once I saw how effective these vaccines were, the numbers coming out at 90 and 95% effectiveness rates in keeping people from getting severe COVID, right? That's what the study showed, people not being hospitalized with COVID. Once I saw that, I was very happy for my parents, first of all. And then when I got the chance, I wanted to jump on that chance. I said in an earlier program, when I was getting my drive-through vaccine, you see the sign that says honk if you need medical assistance. And like everyone else, you have that thought of, am I going to have some sort of reaction? Am I going to have this 1 in 15 million reaction? It's normal. Even though I'm very pro getting this, I had that moment and I just took a deep breath. I never needed to honk. I was fine. I had a sore arm. That was it. But my reasons were really about being able to be around family again. And honestly, to have a sigh of relief. In 7 days, I feel that I can not be as worried and as afraid.
Awesome. Awesome. Wow. Dr. Orzelli, what are your thoughts? What made you decide to?
Well, same as Jodi, protect my kids and my parents. But for me, I had COVID-19 about a year ago. I was sick. This is back in March of 2020 when it just came out. So nobody knew what was going on. I couldn't even get tested to figure out if I had COVID-19 because I had to be 65 at that point, and it was just a nightmare. So I had it, and I'm in decent health, and I was sick for about 3 weeks. So, and then I went back and I got retested for antibodies, and I had very little antibodies. So, so I'm approaching it from a different mindset, which was I had COVID. I was sick. I don't want to go through that again. It was not pleasant. It was really scary. I had, funny thing is I didn't have fever, but I had a lot of chest tightness, and not being able to breathe for days and days and days. It's not a pleasant experience. So I do not wish this on anyone. Yeah. So if you can avoid going through that kind of experience, I would. So that's me. I don't want my kids to go through that. My parents didn't have to go through that, thank God, because they were vaccinated. So that's my reason. And I urge people that even if they had COVID-19, to really consider taking the shot again. Taking the shot because the immunity does not last forever.
Wow. So,
and I think we're so privileged, right? We're so privileged that we can get it, that we can go. It was fairly, I mean, not even fairly, it was very easy for me. I drove through. Everyone was so nice and kind. And I just keep thinking about what's happening on the other side of the world right now in India. And really, we have the opportunity and we have the privilege. And, you know, so often things in life may be outside of our control, as most of us felt over the past year. And I think this is something that is within our control, right? To sign up, to talk to our family members and friends and community members about signing up and getting the vaccine. So it feels good to have some sense of control over what was a very challenging year.
Yeah, it's also about protecting other people. It's about a sense of community. It's about being responsible. It's about making a change, not just saying it, but doing it. Show that you actually been vaccinated, because that will, like we talked about in the beginning, like Jodi said, that's going to bring us to herd immunity, and hopefully it'll go away. But there's no guarantees. But the only guarantee we know is the more vaccinations that we have in society, the less likely of another pandemic like this one. So it is a very important thing to do. Love your neighbors, become vaccinated, do it for the community, do it for yourself and your family.
Thank you.
And I believe in the young adults. One last thing, I believe in the young adults. Your numbers look low, but I think it's because you hadn't been eligible. So 18 to 29-year-olds, get out there and show them and get those numbers up. And we both teach college students or graduate students, and I'm very close to them, and I believe in them. So I think that they will get those numbers up, and they will not be discrepant or significantly different from the other age groups.
Yes, and help us get those numbers up for the surveys. You should see the link in the chat box. So click on that link, even as you're sitting here and listening to this very important talk. Click the survey, click on the link and complete that survey for us. And so I'd love for the audience to hear just a little bit about, so why is Live Healthy Miami Gardens sort of leading this work? And what are the great work that they're doing in Miami Gardens? And if you both can just kind of talk just a little bit about the initiative and why they were so perfectly suited to lead this work.
Oh, I love that question. So I'm a big fan of Live Healthy Miami Gardens. So Live Healthy is a community-led organization, right? So it's about all the people who live, play, work, and worship in Miami Gardens. So working together to create a healthier community. So there's so many things happening in the initiative. One thing that I always give a shout out for is something called Take Your Loved One to the Doctor, which is a year-round movement. And in October, it's a campaign to try to get those loved ones that don't get to the doctor as much as they should, to get them to the doctor. Well, this year, it should be take your loved one to get their COVID vaccine, right? So to give a shout out for that.
Oh, I see they're telling us to wrap it up. We have to wrap it up. But again, click on the survey, reach out for the focus groups. And thank you again for joining us for another chat with Live Healthy Miami Gardens.
Bye. Thank you.
Bye, everyone.